is just to give a tiny context of this in terms of public health. As many of you know in this room, the Royal Society has been a huge champion of arts and health since the very beginning. We have a long history of understanding how important the arts is in so many areas of health, but particularly mental health, which is why you're here today. You probably know that we are very interested in prevention because that's what public health does. But one of the areas where we have palpably failed is around preventing mental health problems. And the statistics that many of you will know speak for themselves. And we have done quite a lot of work in recent years around young people, because that's where we feel we could make the most difference, and where we feel that efforts need to be made if the next generation are not going to be have major problems that not only affect individuals, families and society, but the economy and the greater structure. We're being told that the 20 billion for the NHS will cover some money for mental health. I think it'll probably be about 2 billion, probably not enough. Those of us who look at the numbers with the other organisations, such as the King's Fund, have seen a massive disinvestment in services for mental health over the last 5 years, but before that too. So all the stories you read in the paper about, children having to move 3 counties to get services, these are all failures in the system, and we hope that the 20 billion will help offset some of the worst aspects in the treatment. So if we really believed in parity of esteem, we would be investing a lot more, particularly in children's mental health and in resilience. 1 in 6 young people will experience an anxiety disorder, 1 in 6. And the other issue that we have that really moved us to make some changes in the way we've been working was that there's been a 70% increase in mental health issues in young people in the last 25 years. So that is just a massive change in what's been happening. So if our role is to prevent, I just wanted to mention a couple of things that we're doing and that we're trying to do at the RSPH, and perhaps it'll be background and might help some of the thinking today. So one of the training programs that we've been running nationally is called Connect 5, Connecting the 5 Ways to Wellbeing. It is a train the trainer program for the wider workforce. It means that the fire service, allied health professionals and many others are training people across the country to support individuals and people within their organisations to develop resilience. So it's a preventive program for mental well-being, so that when we're looking at the kind of things and we're feeling ourselves dip a bit, you say, well, what is it I need to do to bring myself up to feeling better about this? And it's an extraordinary good program with great evidence base around that. So we're hoping to roll that out in a much bigger way over this year. We also run the Young Health Champions programme, which some of you know. It's been supported by Public Health England so that we can target disadvantaged young people in particular areas of the country, but also children coming from care and children who are carers. So we have 2,000 young people already trained in the country on peer-to-peer training. So the young person gets a level 2 award as a Young Health Champion, equivalent to a GCSE, and that means that they've got some skin in the game in terms of having the qualification, but they're also able to go and talk and be to the people around them, whether it's school or youth clubs or loads of different kinds of settings. The evaluation of this program has been very good, and we were lucky to speak to the European Commission this year about our findings. So it's a great program, and it's got some political capital at the moment, and we're really hoping that by expanding this program, that can make a difference to young people aged 14 to 19. I should say that one of the largest components in the program is mental well-being, and the reason it's there is that the young people told us themselves that's what they wanted. They wanted to understand how to be more resilient, how to be more confident about things, and how to help their peer group. So a really important program, and I hope to have more to say about that at some point. Social media. We began to be concerned about social media and young people's mental health in 2017. We were seeing more research coming in. We were looking at our young health champions and wondering what young people thought about this. And many of you know we produced a report called #Status of Mind, Social Media and Young People's Mental Health. For those of you who haven't seen it, I'll leave a copy around. But why that was so important is that we actually asked young people what they thought of a variety of social media platforms. We had 14 questions, public health questions, about the positive and the negative around social media and mental health. And interestingly, of course, what we found was that Instagram, which has the most photographs on it for young people, was the most negative for mental health. So the reason we did the report was to create a conversation and a dialogue. We hope to mitigate the most negative effects of social media for young people's mental health and to accentuate the positives, and there are many positives too. I'm happy to say that I spoke at Instagram last week. They're taking this on board, and we've got a couple of new apps that they've built into the new phones. We've set up an all-party parliamentary group in Parliament, which is in the middle of an inquiry right now, which is really useful. I think we'll have a great report coming out of that in the spring of 2019. And the other thing we did was Scroll Free September, which many of you might have seen, to give an opportunity in a light-hearted way to change relationships with social media by taking a bit of a break, either for the whole month or for bits of the month. So those are some of the things that we've been doing. And what I'd say is one of the takeaways I always have when I'm thinking about this is that we need to talk to young people themselves about what motivates them and what helps them. And that's really been behind a lot of the work we've done in this area. And I think that always turns out to be more useful, because if you listen to people, that then you can talk to them about what might improve the situation and learn something. And last but not least, our Health and Wellbeing Awards. As many of you are members of our special interest group on arts and health, we're very proud of the group, chaired by Paul Cammick, who's here, and our deputy chair, Daisy. And it's a really great group of very active people, and it's getting it's got a lot of space in this area now. Public health people are listening, mainly because the evidence is so good. I have to say that I think we've gone beyond the just doing research. We're now into getting stuff done around the country, and I'm pleased to say that the winner of the Health and Wellbeing and Arts and Health piece was around mental health this year, and it won the Public Health Ministers Award. And this is a small programme in Liverpool where young people who'd had mental health problems designed a programme to support other young people with mental health problems in developing illustrations and cartoons. The evidence was massive around this programme, and it's a brand new kind of thought about how to make this work. What we found was that actually the CAMS, that the services, which were huge lengthy waiting lists, we could take some people off those waiting lists once they got help from this programme, and that's the kind of evidence that is absolutely fantastic. And here we are marching ahead on this subject at this brand new network, and I couldn't be more excited that we've got the launch of this here in this building today, because I feel it fits in so well with all the things that many of us have been trying to achieve. You're going to hear more of the details about it from Daisy, but I just want to say a massive congratulations to Daisy and to the collaborators on this. It's a great achievement to win one of these 8 networks, and the fact that we're all here today to press forward, I think it's really fantastic for public health, and it's great to have you all here in the room. So if we can be of any help, please include us in all your thinking around this. One last thought is that we have a new Secretary of State who is much more interested in prevention than our last Secretary of State for Health. This gives us some openings to talk about the work that many people in this room are doing, and of course the work that we're doing. And I think we should be pressing ahead with talking about this to our new Secretary of State as soon as we're able. So have a fantastic day, and once again, congratulations on the March Network.
Thank you so much, and it is a huge privilege to be here today launching the March Network. It was about a year ago that the call came out for people to establish networks relating to mental health, and I started a series of thrilling conversations with many of the people in this room today. What was immediately evident from this was the eagerness and the conviction that we should and could be making more of the social and cultural assets in our communities to try and enhance public mental health, help to prevent the development of mental illness, and also to support those living with mental health conditions. But what was also evident from these early conversations was that there are several challenges facing those of us working in this space. And particularly one of the challenges was around silos. There seemed to be a lot of silos based on asset type. For example, work in the arts happening very separately from work in green spaces in many cases. And there were also assets based on disciplinary approach. We saw subtle differences in language that meant that research from one discipline wasn't necessarily being picked up by researchers in another discipline. And we also saw that there were different types of methodologies, different types of evidence that were given more weight by some people than others. And so this seemed a very natural need for us to develop a network, to be able to draw together the people who are interested in this space, help us to assess what evidence we do have, what good practice we have, and what policy opportunities we've already made the most of, but also to look forwards and think, how can we now work together as a network to actually move this area of work much faster forwards. And what I have to say, once we started writing this bid, it was actually the easiest bid I've ever been involved in, because there was such a synergy in thinking in terms of what the priorities were. And there was also such a willingness from people to be involved. And that's why I'm so thrilled to be standing here today, because I'm genuinely excited about what we can achieve by working together over the next 3 years. So why are we called March? Well, this network is focusing on social, cultural, and community assets. And research suggests that these assets can help to build more resilient individuals and communities. And our proposal as a network is that this whole topic should lie at the heart of considerations on mental health, March. Now, I can't work out if March is an absolutely genius acronym or too complicated for its own good. But the good news is that March also has other positive connotations. It represents a movement moving forwards together and progressing. And it also represents spring, a birth of new ideas, and also a fresh approach. And I think that March is a fresh approach, because whilst a lot of thinking on mental health has focused on deficits, trying to identify and then solve problems, what we're doing is taking an asset-based approach and saying, what are the resources, the assets in our communities that we could be making more of to support mental health? Now, the assets that we're talking about in this are social, cultural, and community-based. And it's really important, I think, that we're talking about these in this time of austerity, difficulties around budgets, because it's going to be more important than ever that we are making the most of these assets. So these can be social, for example, sporting or social clubs, community, political, neighbourhood, residential, religious groups, or community, charitable, or conservation volunteering. They could also be cultural, for example, performing arts, visual arts, and literature. Culture, such as going to museums, theatres, festivals, or heritage, such as significant landscapes, heritage buildings, or historical sites. Or they could be other community assets, for example, libraries, green spaces such as parks, gardens, allotments, or community centres such as leisure centres or town halls. And we want to look more at how these assets are supporting mental health, and particularly do this with a cross-disciplinary approach. And within this, we've identified from the discussions with all of you and other partners 6 key priorities. I'm going to talk about these priorities again in a moment in more detail. But first of all, I particularly want to acknowledge our funder in this, UK Research and Innovation, and particularly the AHRC, ESRC, MRC, NERC and EPSRC, who are the funders for this network. We're absolutely thrilled to have the funding to get this network off the ground, but we're also thrilled to have the recognition of the relevance of this topic area to so many different research councils. So we're really excited to work with them over the next 3 years. I also want to introduce you to some key people within the network who you're likely to be seeing more of. So we've got a pretty lean investigator structure. For those of you who don't know me, I'm a senior research fellow in epidemiology and psychoneuroimmunology at UCL, and I have a particular interest in arts, culture, heritage and social interventions in relation to health. I'm joined on the team by Cam Bree, who's going to wave. Cam is a psychiatrist and a professor of cultural psychiatry and epidemiology at Queen Mary University of London. We also have Paul Crawford, who is here. Paul is a professor at the University of Nottingham in Health Humanities. He chairs the International Health Humanities Network and has previously run a large-scale grant called Mutual Recovery, looking at mental health and community and arts engagements. We also have Tia Denora, who is over here. She's a professor of sociology at the University of Exeter. She has led a number of programs, particularly focusing on music in relation to inpatient and community mental health care. We have Helen Chatterjee, who is a professor of biology at UCL. Helen is a specialist in museums and nature in relation to health, and has also set up the Culture, Health and Wellbeing Alliance, which has got 3,000 members, mainly across practice, developing culture and arts interventions in care and in the community. We also have Jeff Crossick from the School of Advanced Studies, University of London. Jeff previously chaired the AHRC's Cultural Value Report and is also chair of the Crafts Council. And we have Jane South from Leeds Beckett University. Jane is Professor of Healthy Communities. She's just written a report for WHO on community resilience, and she also works within Public Health England. I also want to introduce our 2 newly appointed network staff members. We have Vass James, who is the network coordinator, and we have Louise Baxter, who is the network researcher. So we're really looking forward to working more with you over the next 3 years. But most importantly are the people who are actually the members of this network. Now, when we started with this bid, we had 93 founding individuals and organisations as our partners. And these were broadly split into different categories. We had 40 different researchers, all from different disciplines across the UK, who are already carrying out research in this space, in mental health, in relation to one or more of these community assets. We also had a number of major community organisations. So these include organisations that represent the different asset types that we're engaging with. And many of these organisations also represent many local level organisations as well, and also speak for the users who engage with them. We also have a number of policy bodies, including arts councils, public health bodies, NHS, and also different teams within government. And we also have several mental health charities, PPI groups, and other third sector organisations representing the different types of users that we want to engage. But actually, since submitting our application, we've actually had a further 376 individuals and organisations asked to join, and this is brilliant. We're very much looking forward to watching this number grow and also to engaging with these members. But I want to talk to you a bit more about our priorities, what we're actually going to do over the next 3 years. Now, when we were coming up with this application, I mentioned there was a big synergy over what the priorities should be, and we've narrowed this down to 6 in particular that we want to focus on. 3 of these pertain to research. The first of these is about supporting research on these assets in relation to mental health. So, for example, we want to start doing some more synthesis work, identifying what research is actually being done. We know it's been siloed, but how can we bring that together? How can we identify what the gaps are for future research? And how can we support new research projects to fill those gaps? Our second priority is around developing cross-disciplinary methodological approaches. We know that different people are convinced by different types of data, so we need to work out how can we provide data to different stakeholders that's meaningful to them. And we think the key to this is making more of the different theories and methodologies from different disciplines. We also want to nurture the next generation of researchers in this field, particularly trying to encourage young researchers to move into this space and equipping them with the skills to carry out high-quality research in the future. And then we also have 3 priorities that relate to engagement. The first of these is around identifying and removing barriers to accessing these community assets. We know that people with mental illness engage much less than other people in their communities, but we need to identify why this is. Is this individual barriers that they're perceiving? Is this organisational barriers that community organisations are having that prevent them being able to develop more work with mental health service users? Or is it policy barriers? We want to identify and remove these over the next 3 years. We also want to try and develop more supportive strategies and policies for this space. So this will include encouraging more community organisations to build mental health into their strategies, and conversely helping more mental health policies to reference community engagement and to actively support the development of new community projects for mental health. And our final priorities is to encourage greater participation and public engagement. Everybody's heard of Eat Their 5 a Day, everybody knows about getting their 30 minutes of exercise, but we don't have the same kind of public awareness about engaging with your communities for your mental health. And that's what we want to try and promote through this network as well. So these 6 priorities are what you see in the centre of our logo: cross-disciplinary research, methodology innovation, early career training, access innovation, policy development, and public engagement. Now, to kickstart these priorities, we've planned a series of activities that we as the investigators are going to do over the next 3 years. And I'm going to give you a brief summary of these now. So in relation to the first priority, we're going to be working on a series of new synthesis reports and systematic reviews on this area to try and bring together some of the evidence on the different assets from the different disciplines. We're also going to be running networking events, including some with the Royal Society for Public Health, to bring people together and to help them to develop new research project ideas. And we're going to be doing some of that this afternoon with you. For our methodology innovation, we're going to be running some roundtable events, looking at methodologies, looking at how we could be using them more effectively to answer some of the remaining questions. And we're also going to be doing some surveys and reports on the use of different methodologies. In order to develop the next generation of researchers, we're going to be building on an existing early career research network that we have, which has got about 1,000 members across the world at the moment. But we're going to be building on this to engage more people. We're going to be particularly trying to engage more early career researchers with community organisations that want to have evaluations. This will be an opportunity to give new project ideas to PhD students and early career researchers, but also a chance to give higher quality evaluations and research projects to community organisations. And we're also going to be working with the Royal Society for Public Health to develop an online training programme for healthcare professionals and early career researchers, giving them an overview of the evidence in this field and good practice examples as well. For engagement, we're going to be running a number of roundtable events with mental health service users, with community organisations and with policymakers to try and identify what these barriers are, and we're going to be producing recommendations for how individuals and organisations can develop new work to remove these barriers, access innovation we're calling this. For the policy angle, we're going to be working on a number of policy briefings, particularly responding to particular policy needs as they arise over the next 3 years. We're also working on some specific policy reports, including a report with World Health Organization, which is going to be out in May of next year. And we're also going to be doing some consultancy with organisations that want to embed mental health in their strategies. So, for example, we're already doing some great work with Arts Council England as they're developing their new strategy for the next 10 years. And then we also want to engage more of the public, so we've got a partnership with the BBC that we're going to be developing to try and encourage more of this public health messaging about the benefits of communities for mental health. And we're also going to be working with Nesta on something called the 100-day cycle, where they're going to help more community organisations to become mental health ready, building on the wonderful case studies of many of the organisations that are already doing this type of work. But this is just the initial work that we're going to be doing to kickstart this network. We really want to encourage the members of this network, so you in this room and the people who are joining us online today, to actually engage in new activities and projects as well. So we've got a couple of things that we can do to help facilitate this. The first is that we can provide support to you if you want to develop new projects. So for example, if you've got opportunities, we can help with the dissemination of that. We've already got lots of members and we anticipate that growing. We'll also be able to help with connections. If you're interested in being connected to particular researchers, to organisations, to policymakers, we're going to have the contacts within this network to do that. And we can also help with the facilitation of events. So if you've got ideas for seminar series, for roundtables, for conferences, we can support with the development of those. And then we also have money available. I know that's what many people are going to be particularly interested in hearing about. So we've got £280,000 available over the next 3 years to give away to new projects. We're anticipating running 2 funding calls for this, and a subset of this funding is going to be specifically ring-fenced for early career researchers and professionals. The funding is specifically supposed to be for new research or activities that meet the identified needs that this network is going to be working to identify. And so because 280,000 is a lot for some projects and not a lot for others, so we're going to have a particular focus on seed funding new ideas, for example, testing out the viability of research projects or testing out interventions that could then go on to leverage larger funds. And we'll also have another priority on match funding, other funding that's been received. It's also going to involve consultation with the members of the network on what the gaps and the priorities should be, where we can best effectively target this money to have the biggest impact. So you'll be hearing from us over the next few months about this. And we're also going to be planning the governance for the Plus funds, and again, will be opportunities for people to be involved in governance committees if they're interested in doing so. So we'll keep you posted on this, but we would say don't just wait for the money. We'd say it's definitely worth starting the collaborations and the project ideas now as well, because we know there are many other opportunities out there that you might also be able to leverage too. We anticipate the first call is probably going to be around summer of 2019 and the second call in approximately summer of 2020, but we'll keep you posted on this. So I realise that what I've said so far is very ambitious, but we've decided to set some specific goals for ourselves so we can get a sense of whether we're actually managing to achieve what we've set out. So we've set goals along 3 topics: research, policy and practice. So from a research perspective, in the short term, we want to make sure there's greater connection amongst researchers, and we want to start breaking down some of the silos I've mentioned today. In the medium term, we want to fill some of the gaps that we identified with new cross-disciplinary research. And in the long term, our aim is that the work on community assets and mental health moves right into the mainstream of mental health research. From a policy perspective, our short-term aim is that we've got concise summary reports and policy briefs that are available to network members. We also want to, in the medium term, ensure that the assets are referenced in mental health strategies and agendas. And in the long term, we'd like to see really strong partnership work between community organisations and mental health policymakers. And from a practice perspective, in the short term, we want to have more enhanced awareness about the impact of community assets in relation to mental health. In the medium term, we want to have mental health mainstreamed in the strategies of community organisations. And we also, long term, want to have a greater and more balanced inclusion amongst those with mental illness in communities. So what we're sort of hoping is that in the next 3 years, we can tick off these short-term goals and we can make some really good progress on these medium-term ones in particular. We know that networks are designed to be fluid, they're designed to respond to what happens around them. So we anticipate that our priorities probably are going to shift and these goals will shift accordingly, but this gives us a bit of a sense of where it is that we're heading and what it is we're hoping to achieve as a network. So overall, I think that this network is extremely I also feel that as a network here, this is the right time to be launching this network. And I feel that there's a huge amount that we can achieve together. If we imagine the future of mental health, a central role for communities, community assets is inevitable. But we want to ensure that this remains underpinned by robust research, strong partnership work between community organisations and policymakers, and also supported by really relevant policies and strategies. And that's what I believe that we can help to achieve as a network. I think that if we work together over the next 3 years, we can really transform our understanding about community assets in relation to mental health, and we can really move this from something that sits on the sidelines of mental health research right into the mainstream. So moving ahead with our programme today, I particularly want to acknowledge the Royal Society for Public Health for hosting. As you heard from Shirley, they are huge advocates for this type of work, and we're really excited over the next few years to be able to engage with them more. We've got a number of things in our programme that will be either events held here or activities such as the development of the early career training programme that we're going to be doing in partnership with them. I'm also going to take this moment to mention a couple of housekeeping things. On the ground floor, we've got toilets, so if you go down the stairs and turn left along the corridor, they're along there. There's also a cloakroom there if you do want to drop any coats off. We're not expecting any fire drills. If there is one, you go down the stairs, out the front door, around the corner, don't come back in until who are around the rooms, they'll be the ones generally standing up a bit more. So do feel free to flag them down or ask me as well. I also want to thank all of you for coming today. We were thrilled to have such a positive response. In fact, we had so many people that wanted to come that we couldn't fit everybody into the room. So we are delighted to be working with Mental Health, who are going to be helping us to bring this activity outside the room as well. So this is Andre from Mental Health, and across the day we're going to be tweeting from our account, NetworkMARCH, with the hashtag NetworkMARCH. So please do tweet about what we're doing and how you're responding to the day so that people online can get a sense for what's going on. We also have a number of elves who are going to be helping with other online activities. This includes photographs, podcasts, little vox pop videos. So they're going to be milling around, tapping people on the shoulder and asking if they're happy to have a chat with them. If you are happy, that would be wonderful to do so. This is very informal. They'll be asking you about the type of work you or your organisation do, why you're interested in this topic, why it's important. So there's nothing that you need to have prepared in advance. It's more to get a sense of why you think this is something that we should be talking about over the next 3 years. Our aims for today, we've got 3 in particular things that we want to achieve. We want to design collaboratively with you the best way that we can run this network to make sure it's relevant to all of you in this room and something that you want to engage in. We also want to identify specific ways that we can draw on your contacts, your expertise, your resources to help this network grow over the next 3 years. And we also want to support you in identifying new collaborations, so new partnerships, project ideas, people that you want to work with. So we've structured the day into 3 broad themes. After this introduction, we're going to be moving into a roundtable discussion, designing our network together. I'm going to tell you a bit more about this together in a moment. We're then going to move at about 12:15 into lunch. Lunch will be served back in the room that you got teas and coffees from, and you'll be able to eat in this space. We'll have 45 minutes for free lunch, but then we'll have a kind of extended lunch break where you'll be able to propose topics that particularly interest you. So if you've got, for example, you're interested in children, mental health and nature, or you're interested in older adults and arts in relation to mental health, you'll have a chance to propose the topics you want to talk about and hold your own roundtables on them. So that'll be a good chance to meet other people in the room who've got similar interests, who could be people you can connect with more. We're then going to have some fast fire roundtables in the afternoon on how you want to contribute and what ideas you have for the network. And then we'll close with an evaluation of where we want to be a year from now. And we've deliberately planned some extra networking event time as well later in the day, so you've got more chance to carry on those conversations. So let's talk about what we're going to be doing for the next hour or so. We're going to be designing with you how our network should run. Now this might sound like a cop-out in terms of we should have just done our homework and designed it, but we had a lot of discussions about this, and the thing is that whilst we could come up with a lot of ideas, and we did, about how this could run, we recognise that the only thing that's going to make this something that you want to engage with is if it's meeting your needs, and it's the kind of thing that you actually actively want to be going along to events to, engaging with things online, meeting up with people. So the only way to do that is for you to tell us what it is that you want this network to look like. So we're delighted to be working with Becky Mulby, who's an expert in health networks. She's a professor. She's set up a resource called Source for Networks. And she's worked with us on designing a series of discussion questions that we're now going to focus on. So what I'm going to say in a moment is that people should move to a roundtable. If you've joined us during the course of the presentations, we've got lots of space up at the front, and this will no longer be the front, so it will be much less scary. So do come along and have a seat here. You're going to have a series of questions, a few ground rules on this. First of all, you're not expected to get through all the questions, and you're also not expected to work through in order, because that means no one will get to question number 6. So do start wherever you want at a table and discuss these topics together. The second ground rule is that you need to make sure that you are making notes yourself as you go through. We're not going to do each table feeding back because that would be long and boring. We're going to have a slightly more innovative feedback session, but it means you all need to be paying attention. So we put paper on the tables for that. And the third ground rule is that we know this is ambitious. We know we've got a lot of obstacles we're going to face, but we're trying to do this in a positive and proactive way. So we're looking particularly for solutions and ideas. rather than just the problems. So if you do identify a problem, please also tell us what you think the solution should be. I'm going to now say to you to go and take your seats. We're going to have an hour to discuss these on tables. We've got lots of chance to talk about these questions. But the most important thing is when you get to your tables, we should go around on the tables and say who we are, where we're from, and what kinds of community assets we are working with or enjoy engaging with ourselves, the chance to get to know one another. So I hope you have a really productive day. I'll be talking through the activities more as we go. But thank you so much for joining us today.